Good everyone. Today I'm going to talk about epilepsy. Epilepsy, it's believed that epilepsy is a contagious disease, is a communicable disease. But due to research, epilepsy is a normal disease that can affect anybody, but it's not contagious. And epilepsy is defined as a central nervous system disorder in which electrical activities in the brain are imbalanced, causing recurrent seizures. These recurrent seizures that I'm talking about, these are misfiring in the brain. It's just like electric passing through wires. That's how these seizures are when neurons are misfiring. And when you're talking about epilepsy, just don't talk about epilepsy, talk about the types. We have two types of seizure, the focal seizure and the generalized seizure. The focal seizure is also called the partial seizure, and it starts in one part of the brain, like one side of the brain. That's the one part of the hemispheres. Then transfers to the other hemisphere, and maybe it can cause things like jerking movement. Then, or maybe retarded speech. So generalized seizures. For generalized seizures, we see that generalized seizures, this seizure starts all over the brain cortex and passes or causes involuntary movement in the body. This is all we know about seizures or generalized seizures. So seizures are classified into myoclonic, tonic, atonic, clonic, and tonic-clonic. So for myoclonic has to do with jerking movement in the head, the neck, and maybe the limbs. Then for the clonic also has to do with recurrent jerking of movement in the head, the neck, and the limbs. Then for the tonic seizure has to do with stiffening of muscles. When you start having something like, then for the atonic has to do with losing of body control, where you start having things like falls. The tonic clonic has to do with two, where you start having stiffening of muscles and also jerking movement. Let me say you have your muscles are stiff and you start having jerking like this. Then talk about the causes of epilepsy. Epilepsy can be caused by metabolic problems. In metabolic problems, this is where glucose is not sufficiently transported to the brain. That's called glutathione deficiency syndrome. Have the second cause. The second cause is the traumatic brain injury. The traumatic brain injury occurs when maybe you have car accident or other accident where you hit your head, and this happens where the bones of the cranium presses or causes a depression in the brain, then affecting the neurons in the brain. Three, we have genetics. Genetics has to do with these genes of epilepsy passing from the parents to the children. Then we have the fourth one, which has to do with infection. There are other causes, but I should just stop in infection. Infection, example, we have something like meningitis, where the meninges is affected, and barriers or blood-brain barriers in the meninges is also affected. And this infection enters the neurons and also affects the neurons, causing most firing. So, this epilepsy, you cannot just diagnose someone of epilepsy. There are things that you can see to detect that this person is an epileptic patient, and that is what I'm going to talk about now. For an epileptic patient, you start seeing things like seizures, seizures like jerking movement, like I said before. Some people have focal seizure. In some of these focal seizures is where your vision is impaired or you are staring at the sun when the seizure starts. You cannot just diagnose epilepsy without seeing things, and these things we call them signs and symptoms. And these signs and symptoms include jerky movement, stiffening of muscles, and also maybe impaired speech and loss of consciousness. Don't forget that. And this stiffening of muscles and also jerky movement can cause falls. We have to prevent that. So to prevent falls, you have to protect the extremities. And in protecting the extremities, you don't have to stop those seizures from occurring. If you try to stop these seizures, it will cause more recurrent seizures that are so strong enough to cause more injuries. So you have to take that in note. And we have anti-epileptic drugs, and we also have ketogenic diet. In this ketogenic diet, it has to do with fat, and this fat helps in sending or giving the brain enough energy to do its work. Then for the anti-epileptic drugs, it helps in suppressing these seizures in the brain. So the kind of advices you give to an epileptic patient is to avoid driving. That's because seizures can occur at any time. Then also encourage this patient to always participate in exercises. And then this epileptic patient should always avoid excess stress. This is because it affects the brain, don't forget. And also you can also advise this patient to always take fluids. Okay, thanks for having me. It's your nurse educator, Prince Lobeten. Thumbs up. Also subscribe in the bottom below.